This conference will now be recorded.
Yes, welcome to Rayz and today we are going to have the part 2 orientation session. So as you all know, you have been through the part 1 journey and success is definitely doesn't come to you. You have to go and grab it yourself. So MRCG is a similar way. When it comes to part 1, part 2 and part 3, part 1 is all the basic science that we have seen. And part 3 is going to be more of the communication skills dealing with how you do it in an OPD basis, post-operative surgical management. It could be gynec, maternal medicine like that. So it is more of a patient-oriented kind of an exam. There also, the actual patients are not there, but it is going to be a simulated patient who act as a patient, and it's across the table that you're going to have a discussion. And about the part 2, it is more extensive among all the 3 parts because you need to know all the green top guidelines. There are different NICE guidelines, the TOG articles, and we also have some supporting documents such as the consent advices, the sexual reproductive health, contraceptive, all the details, FSRH guidelines for us. And you will also get some scientific impact papers. All these things, they would contribute minorly to your preparation, but major is all your green top guidelines, NICE and the talks, and that too recent ones because they keep on updating the question pool. So it is going to be a kind of preparation where you may have to contribute at least 3 to 4 hours per day for the revision. And as I say, you need to know the guidelines thoroughly. The first reading that you're going to do, I'll be providing the Telegram link where all the guidelines, the course materials have been already posted and students have been using that. So in that particular link, you'll be getting all the guidelines. If you're not finding anything, let me know. I can repost that again. So the guidelines, you just have to give one good reading the first time, and the same guidelines are going to be discussed. And I'll be putting up certain live recordings where you have to listen to the preparation of the guidelines. And in the live session, I'm changing a little format because previously also students were finding it difficult for a longer sessions. So I had to break open and do multiple sessions as well. So in that situation, what we can do is the guidelines, the videos will be put up where you have to listen to every guideline of that. It's going to be a kind of revision that you have done already, the reading part of it. And in the live session, we are going to have the discussion, the SPAs, the EMQs regarding all that particular module and supporting with the explanation that we are going to extract from the guidelines. So in that way, we are going to have a revision there. And the format of this particular exam, it is online exam. As you have given your part 1, you have the Pearson View Centers. It is going to be 2 papers, 3 hours of each with a break in between. It consists of single best answers and extended matching questions. Now, extended matching question is something different from what you have done before. Single best answer, you're getting 4 to 5 options in which one best answer you have marked. It is what you did in part 1 MRCOG. When it comes to extended matching question, you will have almost like maybe 12, 15, 18 options also. In a particular paper, you have all these 18 options, and below are some 3 questions. And every question is different. It is linked with that particular topic. For example, if you're reading about chicken pox in pregnancy. So the chicken pox in pregnancy related, you will get answers written as 1820. Below that, you will have 3 questions which are from the chicken pox. And each question you have to choose which suits the that particular question best. That answer you're going to select and mark it. And next is the second question. Again, amongst those 18, you have to choose and mark. Then next question. And some, like for example, venous thromboembolism. There you'll get another 4 questions as extended matching. Again, you'll get some 15 to 18 options. Then there are 4 questions or 3 questions which are related to venous thromboembolism. So extended matching questions are, you're going to match that particular question with the best answer that is given there. Rarely same answer may be suitable for 2, but it happens rarely like that. Otherwise, they'll make sure at least one question, one option you're going to choose. And this is where you have to concentrate more, because the options may look very similar. The dosages may be given a little different. For example, 5 days is given as 7 days, or the dosage, the medication value could be a little different. It must be changed. And similarly, the labor module. So the options would be like induction now, induction 24 hours later, or it would be category 1, 2, 3, 4 cesarean. So multiple options are listed out. So you know that this is an emergency case. You're not going to look at the options where induction of labor, wait and watch, those things are there. If you feel that your question is about the rupture uterus, it is going to be a category 1 cesarean. So you know that. And about the umbilical cord prolapse, then you're going to look at the fetal heart rate. If fetal heart rate is also showing changes, then it's CAT 1. If the NST is stable, it is CAT 2. So these things and all basic things I'll be teaching out in the live sessions and the discussion about the questions also. So your scenarios, everything would be dependent on one topic, and your questions would be there. There you have to match that particular answer and write. So though the number of questions would be the same for single best answer and extended matching questions, but your EMQs carry more weightage compared to your SPA. And here it would be like single best answers would be worth 40% of your total marks, where EMQs are going to be 60% of your total mark. So they have the score adjustments where they divide it and see, and every paper you have to clear. So SBA EMQ and paper 2 again SBA EMQ. Only when you're clearing and reaching the expected standards in that particular SBAs and EMQ in all the 4 domains, then it will be a clear. So in this situation, you have to make sure that the preparation is such that you'll be scoring well above, because they take a common percentile and see that average students how much they have performed, and keeping that as the pass percentage, they see that how many have performed above that, and those people are cleared. So similar to your part 1 MRCG, how it goes. And the duration of this exam, 3 hours in the morning, 50 SB, 50 MQ. But however, the EMQs are going to consume more time, because you have to read all those options and then look at the questions also. So you have to distribute. And what RCOG recommends is you give around 70 minutes for those 50 SBAs, and around 110 minutes is for the EMQ. So you're giving almost like 40 minutes extra for the extended matching questions. I would rather say even if you give 60 minutes or even 50 minutes for an SBA and use the remaining for a EMQ also, that is fine. Because to solve an SBA, it's hardly going to take 1 minute per question. So even plus minus some 10 minutes also, if you keep 60 minutes would be more than enough for your SBA, and utilize the remaining time for your extended matching question. And this is going to be a computer exam, so you need to scroll down all your options, and then you have to see that whether 2 or 3 extra questions have been written, and accordingly you have to go on marking them. It may take a little more time, so keep your time saved for extended matching questions. And in between two papers you'll have approximately 60 minutes lunch break, and then you'll have the second set of paper. uh, Generally, what they would do, the gynae module in the beginning, gynec related and the obstetric related later, but there are chances that some guidelines could overlap, or some questions may be overlapping. It doesn't mean like paper 1 may not completely have like obstetric, some question related to that may come, and paper 2, if it is more of an obstetric, some gynae related topic may come. So just be prepared. It's not like purely, but majority, one paper they're going to concentrate on gynec, and one paper they would concentrate on the obstetric part of it. Regarding the dates, Wednesday, July 2nd is the exam. Uh, Tuesday is going to be part 1, and Wednesdays are kept for the part 2. So Wednesday, July 2nd, you have to mark your calendars, and expression of interest to write this exam would close by 25th March. So by then, if you have given your part 1 exam, or you have already cleared that, if there are students who have been waiting for the part 1 exam results, but they would like to join the course, or you have cleared it in the previous one and now you are going to give your part 2, you have to fill the expression of interest form. So log into your RCOG account, go to the exam book and exam section, go to the part 2, and you have to open the expression of interest, and then you have to fill that. Only the candidates who are going to fill expression of interest, they will receive a mail to book the exam. and booking window would open on Tuesday, 22nd April 2025. So I would rather suggest that the same day, same time the booking window opens, you are going to book your exam. Otherwise, there can be possibilities that the center that you want to choose, for example, if you want to choose Bangalore as a center, the seats may get filled up and you may land up going to a different city to give the exam. That could be a little challenging, new city, a new place, travel arrangements, everything. So what you have to do is, as the booking window opens, the same day, same time, log in, and then you have to book that exam. I'll be guiding you through the booking as well. So as when the day approaches, how it is done, when you have to select everything, I'll be guiding that. And booking window would close on Thursday, 3rd June, but nobody waits till then. Most of the seats get filled within like 1 or 2 days itself. Probably most of them on 22nd itself. And the result would be released close to 28 working days. Now, about the expression of interest, change of anything, and the ID proof, make sure that the name that is depicted in your RCOG account and the ID proof that you're carrying to the exam, it has the same name. Even initials, letters, in between initial or later the surname, if it is whether full or even the initial, only one letter is there, everything they are going to check it. By chance there is a discrepancy, you can still carry any affidavit stating that both the names are same. So lawyer, somebody can just give an affidavit as well. So make sure at least you have an ID card which is same as the name that you have filled in RCOG details, because once you have registered with that particular name, they will ask you to produce a proof of that same name. So since you have already done your part 1 MRCG, I hope there was no difficulty in proving your identity. Some centers may accept that if they just cross check and accept, but some centers, when a lot of candidates are there, they may be a little adamant on getting the same ID card. So make sure the ID card also completely matches. So please mark all these particular dates in your calendar and keep a reminder as well. Now, speaking about the fees and the banding, for Indians, it's going to be the band B, which is close to 572 sterling pounds. And these are banded according to the international membership subscription of those country, and then the bandings are assigned. So this is what they have put up in the website for 2025 fees. The banding for India, it's going to be band B, where it is 572 sterling pounds. And similarly for UK, Republic of Ireland, band A, band C, the countries are written over there. So all you just have to do is you have to click the band, it opens, and then you have to cross check the country and then fill also. Now, study materials and preparations, there are practice books, there are guidelines, and you have all the recall papers as well, where students have tried to recollect the memory based questions or the topics, what it was. It may be incomplete most of the time because no one remembers all the questions completely. The options can be sometimes incomplete, or at least we would get to know that this particular topic is important for exam point of view. So even though some recalls in the previous papers may be incomplete, but they are still helpful in giving attention to that particular topic. The study material preparation for part 2 is going to be vast. For that reason, we have to work smartly. Yes, we know hard work pays, but again, in this era, we have to do, along with some hard work, it has to be smart work. We have to choose the quantity and the quality together, keep things flexible, and make sure that whatever the time constraints are there, everything they are utilized best. You have to be more efficient, more effective, rather than giving first reading, second reading, third reading like that. You have to go on revising simultaneously, because first time one guideline may take almost like close to 20 minutes, 30 minutes, or even sometimes an hour. You just keep it like that. So once you read one particular guideline for the first time, you're going to just mark your important points. So if you're a person who is using a laptop to read, you can just highlight that in the PDF. Or if you're a person who takes a printout and mark it with a highlighter or pen, so you just have to mark it over there. That is going to be your first reading. But again, as and when you start reading the guidelines, you'll understand that you're able to grasp things quickly. all the recommendations which are there, they are in the bold letters. They are very important. You cannot just skip them. So all of them also we have been like, collecting and putting up in the summaries as well. So they are extremely important and they're helpful for a quick revision. Apart from that, there are certain here and there percentages, but I would say give percentages a little less weightage. There are very much important percentage which keeps coming as a recall. So those I'll be stressing upon, but otherwise very minute and studies, cross-sectional studies here, reviews, systematic, everything. Not everything what is mentioned is important. So I'll be highlighting them also in the recordings as well as in the live sessions. So apart from that, once you do one particular guideline, you should understand what the subject is, what the topic is exactly. And the next, whichever module I'll be taking up, I'll put up the list of all the guidelines, the articles that I'll be going to discuss in that particular live session, and the questions would be based on these guidelines. So I'll be providing recordings, everything prior, so that you go through the recordings, you listen to them, you read the guideline, you listen to the recordings, and then you come prepared for your live session also. So in that way, you'll be getting time at your convenience to read and listen to the recordings. And when we have the live session, we'll start discussing all the questions. And then you'll understand, okay, this point is also like an important thing for us. And that is why we have to stress on this particular point. This has been asked in the previous recalls as well. So in that way, we are doing one particular module, and then we go to the next one. So I would always, advise that one day in a week where most of the time you're free, be it like a Sunday or Saturday, or sometimes you're having an off on Tuesday, depending on your week schedule, how it is, when you're relatively free from work or something. So make sure that day you're going to revise the previous guidelines, and then you're continuing with your current guidelines also. So when you're going to revise the previous guideline, it's going to be a quicker one. So when you read the guideline for the first time, if it has taken half an hour, even probably 1 hour, the second reading that you're going to give, it is going to be hardly 10 minutes, because now you know which part you're going to concentrate more. You're going to highlight them, and whichever questions or important points are there, just put a small star or something beside that, that you know that this has been asked as a recall or this is an important point. So with a pen or something, just go on putting a small star over there. That is important. And next module which we are going to discuss, you will be reading that particular week, those particular guidelines. So the reading of these green talk guidelines, nice and important talks which have come repeatedly in the exam, I'll be discussing in the live session. Uh, all, like almost all of the nice guidelines and complete green talk guidelines, I'll be taking up in your live session and discussion. Talk articles every year, the Journal of Obstetrics and Gynecology, they release 4 issues. One comes in the Jan, April, July, and then October. And there are at least 7 to 8 articles that are important, and remaining would be some a kind of notes or something would be there, which are not that important for exam point of view. But the articles which are there, like 7 to 8 pages together, every issue that comes out has these 7 to 8 articles like that. And it is not important to read completely. The summary of these or the important points of this would be again put up in the website. What you are expected to do is, at least the recent 5 years, you should be reading those guideline summaries, and even the articles and the question bank would be there in the website. So this particular talk article and related questions from that particular talk, so they are placed in such a way that you have the article, you can open up into the website, and then you have the questions which you can solve it in the website. So whenever you're free, you start doing these articles also. So one particular week, you're going to concentrate on one particular issue, and the next one. So in this way, within 2 to 3 days, try completing 7 to 8 articles from that. In that way, you'll be able to finish all the 5 years articles, plus the important talk articles which are there before as well, which can come in the exam. And it may be like 2012, 2013, or sometime 2016, but those articles are purely in the TOG. They are nowhere in the green top guideline or the nice guideline that have been there. So those topics are not there elsewhere. Those kind, however old the TOG article is, I'll be discussing them because they still have some exam-based questions on which are coming from this particular guideline. So I'll be discussing that also in your live session. So those important talks also I'll be putting up. And every module, whichever the talks are important, they are also asked, like they are also put up there. And the questions from which have come from that talk also I'll be including in that. So in this way, these three are the important one: the green top guidelines, the nice guidelines, and the recent talk articles. Now, when it comes to FSRH, BASH, FIGO guidelines, FSRH is about the sexual reproductive health and it concentrates on all the contraceptive part of it. So in this particular thing also, I'll be putting up every article as an individual recording for you to go through when I'm going to conduct this FSRH module. And the BASH guideline that is on the sexual health and all the infections that are going to get covered. So I'll be putting them as an individual recordings. So you go through the article, you listen the recordings, and then we have all the questions and backed up with the explanation from these guidelines. So these are going to be combined together. And all these FSRH, whichever the important ones, everything I'll be covering, plus all the infections and related questions would be covered. About the FIGO, they have released the cancer updates. So the recent updates, which involves the endometrium, the cervical cancers, fallopian tube, ovarian, and the peritoneal cancers, and even the vaginal cancers, vulval cancers, the gestational trophoblastic also they have released. All these things are going to be discussed in your oncology module. So oncology plus you will have the pre-cancerous conditions. So there are ovarian cysts which happen in the pre-menopause, post-menopause. There are endometrial hyperplasia guidelines, and there are all the NHS cancer. So the cervical screening programs which are there. All these modules, it will be covered in the oncology module. And recent updates have come up in 2024. I'll be discussing all those things in your cervical cancer screening. And NHS has a very strict protocol about cervical cancer screening programs as such. So I'll be discussing all of them and how to approach stepwise for your extended matching questions. About the consent advice, these are the consents which are basically for your surgical purpose and all. And sometimes valid consent, it would be related to some procedure, the frequent complication, serious complication, or what you're expected to. So these consent advice, they're group of articles which will concentrate mainly upon explanation, the percentage risk. So some of the percentages they have been frequently asked in exams. So I'll be covering them as well. And SIPs are nothing but scientific impact papers. Some articles questions have come up. So the important SIPs I'll be putting up during the module wise discussion, and I'll be discussing the questions based on that as well. The ESHRE are the European guidelines. So there are in combination some ESHRE guidelines also have been followed in the NHS. So especially these endometriosis, premature ovarian insufficiencies, and even the PCOS guidelines have come up. All these, the newer ones, ESHRE guidelines, that also will be covering. About the embrace, so this is regarding the maternal death reports and other guidelines which are important, and they're focusing upon the improvising the maternal and the perinatal morbidity, mortalities and all. So this report, it keeps getting updated. So the most recent one is going to be discussed. About clinical governance, these are something which is a kind of a pillar for how the NHS system works. For example, there is a complication. So that complication has to be reported. So that is called as an incident reporting or a DTIX that they generate in the system, and they report that okay, this person had this surgery and then there's a ureteric injury and this has happened. So they report it from their side. Then there is a risk management team which analyzes all that scenario. It is a team of professionals who look into, like, what things have happened, what could go like, what went wrong, how this could have been prevented, or in future what to take care. All these things they would be concentrating upon, and they give a report which is unbiased. They can hand over and explain things to the patient as well as the um, they look into that particular case scenario. So a risk management team is involved in that. There are kinds called as a reflective practice. For example, it is a patient came with bleeding and she had urine pregnancy test positive, so and pain in abdomen. So you would think that probably she had miscarried, but it could be a ectopic pregnancy, ruptured ectopic. So the candidate or the on-call resident who is there, they must have forgotten, or they thought it is just a simple case of a miscarriage until unless the patient collapsed, and then they did a scan and just to find out a hemoperitoneum. So in that way, it was something which is diagnosis was missed. So, but reflective practice is something like, okay, uh, what improvement would you do for yourself to prevent these things from happening in future? So you have to reflect back on your own things. Okay, I would have thought differential diagnosis, I would have thought of taking an opinion from a senior, or probably ask for a scan just to confirm that any other concerns are there. So all the DDs have to be ruled out, and then you're arriving at a conclusion. This kind is called as a reflective practice. And similarly, there are auditings that would happen, which is similar to the thesis that we do. There is a set of cases, or it is retrospective or a prospective study that they do, collect the information, present it, and then implement all the changes. After 6 months, again, they do a re-audit, and then they see like, have things improved? So maybe training sessions, maybe managing shoulder dystocias, maybe managing or bringing down the cesarean section rate, all these things. They look into those factors. They do internal audits and all. And about teaching, this is very important for your part two. A lot of teaching methods are there, and the importance of that, examples are given, and they have asked you to name them. So I'll be covering those part of teaching as well, and some other important topics that would come in the previous recalls. And strategy, this is nothing but the core knowledge that is given in your RCOG website. So if you're an associate member to that, you'll be getting access to various study material which is there in the RCOG, and module wise they are given. They go on explaining things, and there are expectation that some questions would come, but again these kind of questions have been collected, and I'll be discussing them, and few, like most of them, they are uploaded in the website also, where you can just have a look at them and solve. So the strategy questions, again, they are important. And about the practice books, so there are a lot of books and each book is important. You have close to like 10 to 12 books over there, where some books are targeting only extended matching questions, some are targeting only SPAs, and some have a mixture of both. So every book is important. The recent editions, they are there, but even books, if they are old as well, they have a very good and valid questions from which the questions can be framed and come. So they are very good for your practice, but again the options could vary depending upon the updated guideline. So this books, all these would have published in 2016 or 17, but there are guidelines which have come up later, so the options and the answers could change. But at least if you read the question, you will know that okay, this is a particular thing they are expecting. So according to the current guideline, this would be the answer. So some guideline, some books they have updated, but some books again they are still a bit the publications are a bit old. So but they are very good like important things to solve. So these books also will be solving in the Telegram group, and we'll be discussing all the answers there as well. So on a day-to-day basis, every day few questions from the books also will be solved, and simultaneously would encourage that these all PDFs would be there in the Telegram group. If you want, you download or read it in the laptop as well. So you can keep solving these yourself, plus follow the Telegram group daily discussions for the single best answers, extended matching questions, and we would go book wise solving it in the Telegram group. So these are all important ones, and all these PDFs, everything, They are available. You don't have to buy them or purchase them. They are there in the Telegram group. So every book, even if they are old enough, just make sure you're going through the questions. So all these are the important SPA and EMQ books. Now, regarding the website usage, um, I'll be giving access to certain set of all materials, and there is a course material. So in the course, which is particularly for the July 2025, so in that course, I'll be uploading all the live sessions that would happen, the recordings of the live sessions. So by chance, if you have missed anything or you want to listen it at a later date also, all the recordings of the live sessions will be there in the website in that particular July 2025 course. The remaining part of this website access that you're going to get, you will be getting summaries of all the guidelines and the audiovisual summaries that I'm going to put up. You have the mixed pool of all the recall questions. What I would say is, um, start solving these questions. Even if you have not read the guideline, you can give an attempt, because once if you select an answer, if it is correct, the website tells you it is correct, it will get you to the next question. But in case if it is wrong answer, it will prompt you what is the answer. You need to select that and go to the next question. So it will make you understand that, okay, this is the question, this. And by chance, if you get any glitches, you update me, then we'll solve it then and there. And the GTG and nice question pools also have been created. Important talk articles related questions have been put up. So you get an article, you get the question pool, you get an article, you get the question pool. So all these talk articles have been arranged year wise. So for example, you get 2021, 22, 23, 24, and the recent one has come up, which is 2025 Jan. So that also we are going to update it in the website. Then closer to your exam, you'll have access to the mock exam. So since the exam is going to be in July, you will be getting this particular access in June, because I want you people to be thorough enough and then solve and take up this mock questions. And Telegram group will be there again for a recall discussion. So everyday basis we'll be discussing few more recalls. We will start involving ourselves in at least like daily basis 1 hour, where the recalls are going to be discussed again and again. That way it keeps refreshing your memories, and some percentages which could be volatile, when you repeatedly revise them, it is going to be etched in your mind and you're going to remember it for a long term. So revision is extremely important. However, we are going ahead with the portion, you have to revise the previous one. So probably every week, as I said, keep 1 day for your revision where the previous guidelines you're revising and going to the next fresh guidelines. And in the Telegram group, you will be having the course group as well, where I'll be putting the link for all the live sessions that we're going to conduct. The timetable will be shared there itself, and the modules and the guidelines that are going to be discussed in that particular module will be put up. Apart from that, you will have the general group where Rayz part 2 is there, where it is open for general group. We'll be solving the books over there, and recalls will be solved in your course Telegram group. Then another Telegram group is created which has all the course materials which are for your easy access. So directly you cannot send them. What you have to do is you have to click open the PDF. You want to share it, you can share. You want to download it, you can download once it is opened up. So if PDF you need to share, you cannot do it directly. You have to open the PDF and then you share it to yourself, or you want to download it or put it up in the website and like your mail account and then take a printout. So you can do all those things later. But all the materials, whichever recent guidelines have been updated, everything keeps getting accumulated in your part 2 materials. So that is important. And the recent questions that will be discussed. So schedule wise, weekly topics are going to be shared. The questions are going to be solved accordingly, and Telegram support would be there throughout your course. Second revision would be a targeted one. It would be purely a recall based kind of concept based kind of a revision. This I want you people to do in June. So June month will be like completely utilized for all these recalls. So in this February, March and April, these 3 months we have to finish all the particular module wise topics and all. For the June month, it is going to be a complete revision for all the recall based targeted. And it's kind of a marathon revision for the last 10 days, where just before your exam, you're completely engrossed on, like, throughout your day, you're utilizing almost 8 to 10 hours for your study purpose. And even if you are able to contribute even 12 hours. So it is just the revision of your guidelines, the revision of your recalls. It is going to be purely based on that. At that point, I do not want you to use your books. So your June and July, the beginning part of it, it's going to be purely on the recall based revision that is going to happen. All the books part of it, everything we have to finish off, all the reading part and the live session, we have to finish in your February, March, and April month. So it is going to be a beautiful journey. We have to do it all together. And important thing is the commitment. I want all of you to have a good commitment for this, for your exam on a daily basis. Try to keep at least 3 to 4 hours aside. And whenever you're free in your workplace, at your home, pick up one guideline and give it a thorough reading. Questions have been changed recently. Questions are constantly being updated in the RCOG question bank. So you may not accept, expect that exact recall to appear, but it would be somewhere similar. Or the person who has, recollected those kind of a questions, the options may be a little different. It is very much important that the basics have to be strong and the concepts have to be clear. For that reason, everything that is there in the guideline, that is important. You cannot even change the sentence in the guideline. You have to read it and remember the way it is. For example, you're going to offer steroid or offer magnesium sulfate for a preterm till this particular weeks. You can consider it up to so many weeks. So when it comes to offering, it is mandatory that you're going to give them. But considering is something optional. So every sentence is important. In your exam, they can ask you that magnesium sulfate, it can be considered in a preterm baby till how many weeks, or it is offered till how many weeks. So both the sentences are going to have a different meaning, and it is important for us to read it that way only in the guideline. So you cannot change, you cannot get some shortcuts over there. You have to read the guideline as it is. And these offer, recommended, considered, all these things, words you just have to highlight because that is very much important. And most of your stations that come up in your part 3 exam, they are all based on these guidelines. And your preparation for your part 3 is going to be super easy if you're thorough with your guidelines in your part 2. Your knowledge, you just have to refresh a little bit for your part 3 exam that time, because you would have already studied so extensively for your part 2. This is all that you're getting your the knowledge that you're getting through the guidelines. You will apply that clinically in your part 3 exam. So make sure that the basic part of it is your part 1, but that thing won't come up in your part 3 exam. But what, like almost 99% of whatever you're reading for your part 2, that is extremely important for your part 3, because your applied clinical knowledge is all based on these particular guideline. So remember, when you're preparing for your part 2, simultaneously it is making you well prepared for your part 3 exam also. So you have to target in that way, because the time duration between your part 2 and part 3 exam is going to be short. For example, you clear your exam in July and you're eligible to give your November exam. It's the preparation is going to be short. So within that time frame only you have to prepare. Similarly for the Jan batch and the May batch. So by the time the results come, it could be like February, and within that, the March, April, and then you have the exam in May. So it's going to be a short, and there are other things that you have to concentrate rather than only refreshing your knowledge. So when you're doing your part 2, keep your part 3 also in mind. And similar way, you have to read it thoroughly and keep it in your long-term memory. And these guidelines are definitely going to help you in your day-to-day practice, because when you are updated, you are implementing that particular guideline in your day-to-day practice, you're going to remember it in a better way. So you know how to manage every patient that comes and walks in your OPD, because you have read all your guidelines, you know what are the protocols. You're going to chart out a proper management for your patients as well. So this is also going to improve your the patient safety as well. So it is important that we prepare our part 2 very nicely and be dedicated at least 3 to 4 hours per day. You keep it aside so that you're going to give a exam in clear it in one go. And EMQs are going to take a little time. It is going to drain your brain out there because you have to read so many options. You have to scroll down. So for that reason, make sure that the algorithms, the charts that are there in the guideline, it has to be solved stepwise. And you should know, okay, if this is the thing, what is next? If this is the thing, then what is next? So it always goes stepwise. And your EMQs are extracted from these kind of algorithms or the flow charts that are there. So I'll be discussing them also in your live sessions. But when you're reading a guideline, you come across any algorithm, every point in that algorithm is important. Every point in that flow chart is important because that is going to frame EMQs for your next exam. So concentrate on that as well. So let's start our journey, and I welcome you all for Rayz Academy and sharing the things. I'll be creating a group where the timetable, everything would be put up. And just let me know, we'll have a discussion that which day in a week that you all are free, so that we can the frame the timetable accordingly, and that particular day we'll have our live sessions. So any doubts that you people have? Is it clear?
Clear, ma'am.
Okay, good. It's all set. So this February, March, April, and May is going to be like thoroughly dedicated for your part 2 exam. June is thoroughly for your revision, and July you're just going to rock your exam. Okay?
Okay, ma'am.
Yes, sure. So take care, and I'll create the group. We'll have a discussion there, and then let me know accordingly. I'll put up the timetable for you all. Thank you so much for joining in. Take care. Good night.
Thank you, ma'am. Good night.
Thank you. Good night.
Thank you. Good.
Thank you. Good night.